Bismillahirrahmanirrahim. Assalamu alaikum. My name is Professor Dr. Madhya Malik, and I have done my postdoctorate from Northwest University, South Africa. And currently, I'm working as professor and director of pharmacy department at Hamdard University, Islamabad campus. Today, I would like to discuss a very important topic, which is basically the prime issue of Pakistan, that is patient-centered evidence for health resource allocation, health equity, which is a priority for Pakistan. If we talk about Pakistan, the total average health expenditure is less than 3% of the country's total GDP. And the allocation is of very limited healthcare resources in Pakistan has led to different issues of equity, accessibility, and fairness. The total public healthcare expenditure is just 0.9% of the total GDP, while only 27% of the population benefits from the full healthcare coverage, and 60% of the population lives in the rural area in where there lies the problem of accessibility and affordability for healthcare services. And as you know that the literacy rate for Pakistan is quite low, and Pakistan ranks like at 113 out of 120 countries. Now, this has called for patient-centric model for improving resource allocation and patient access. Now, to basically achieve this objective, there is an organization with the name EUROQOL group, which is the top among the top three healthcare organization of the world, who are working upon the health coverage of the universal health coverage model, and they have developed that in more than 90 countries of the world. And they are basically using patient preferences, population and patient preferences models, different models. They have their methodology, and which has led to improved decisions, and in return they have been able to develop health technology assessment systems of the world, as well as they have improved universal health coverage around the globe. So their focus is basically on health, on your health today, and quality of life is the basic. It forms the basis of these healthcare modeling, starting from health index, and then there is a poly calculation which is being done on the basis of using different multinational clinical trials, and two important techniques, that is the VAS, that is visual analog scale, and time trade-off techniques, that is the TTO techniques, are basically used, which help us to develop population-based models based on patient-reported outcomes. So how it helps us to, or how it helps to basically, how it helps the country to basically include such modeling in their healthcare system. It provides with an opportunity of choosing between alternative treatments for a healthcare technology, or even for a healthcare service, or it tells us how to allocate healthcare budgets to that based upon the patient preferences and the needs which suits best for all the patients. And it also tells that the drugs or the health technology which are being introduced into the market, are they really good value for money, and it helps to add and ensure the benefit and cost of healthcare effectiveness by introducing the good value for money in the healthcare system. So the need of the hour for Pakistan is to improve its healthcare resource allocations and patient access. And as till date, health outcomes are purely based on clinical endpoints. But now we need to consider patient-reported outcomes if we really want to have a good healthcare system which provides a universal health coverage for all and improves the accessibility and affordability of healthcare services. So in this context, I contacted EUROQOL in 2019, and there were the 22 countries all across the world applied for the funding, and the 11 countries got the funding, and I applied on behalf of Pakistan, and I got that funding. And this was the team which helped me to develop the healthcare model based upon the population preferences using TTO and DC techniques. That is the pure protocol of EUROQOL, and we were able to develop that for the first time in Pakistan. So the primary objective of the present study were to examine acceptability and feasibility of using these techniques and the study protocols with the Pakistani population. And if I talk about the methodology was purely based upon the EUROQOL protocol, and that was a multi-center population based in Pakistan, and it has got two components. That is the quantitative component, which consisted of EUROQOL portable valuation study techniques and using the TTO and the DC. And the other component was qualitative, which was based upon different qualitative interviews. And 300, the sample of 300 was achieved by using purposive sampling, and we used like 3,125 health states based upon the five important domains that were mobility, self-care, usual activity, anxiety, and pain. 28 hypothetical health states of varying severity levels were grouped in 10 blocks, with 10 states per block using a composite TTO approach. And for DC, 60 pairs of health states were grouped into blocks with 10 pair each, and regression analysis was carried out for predicting the health value database for Pakistan. So this is basically the TTO value for literate and illiterate respondents. This is a model basically based on TTO value for both. This is a model, DC model, which is basically is the estimates for literate as well as illiterate respondents. And we also calculated the odd ratios of the health domain severity for literate and illiterate. Although the original model is quite complex, but due to the limitation of time, I've not been able to show all the models here, but this is the basic model the results which I am showing over here. And on the basis of the results of this study, it confirms the acceptability and feasibility of using these preferences elicitation methods with the Pakistani population. So how it would contribute to the healthcare system of Pakistan, basically provide a basis for drug reimbursement decisions using the economic evaluation of health technologies, and it will also help to integrate the healthcare system based upon the patient reported outcome, which in itself is a big step towards patient integrity, and it will help us to engage patient. It will help us to engage patient in the healthcare system of Pakistan. So the present research shows that in marrying and valuing these health state, Pakistan can be compared with the leading countries across the world. But as this is the first step, in Pakistan has still to deal with model, cost, data, effectiveness. But this research shows that although we have taken the first step and we are moving towards the comprehensive HTM methodology, which we can develop in a very short time span, rising at international level. And the finding also tells that the activity and mobility dimension were the most effective, which most affect the utility, which could be considered by the government of Pakistan while designing different policies and allocating the budget for different domains, and especially looking at the disability terms. There should be certain interventions and healthcare budget allocation quota for the disabled. And moreover, anxiety and mental health problems were identified the highest among the Pakistani population, which also calls for need of inclusion of psychiatrists and mental health professionals in the national health insurance schemes. I'm very glad that the government of Pakistan has recently also taken a very great initiative of developing mental health policy, which is an initiative led by the President of Pakistan, Dr. Arif Alvi, for the first time. And I hope that this basically value sets will also help us to develop cost-effective economic models which fits best in the Pakistan healthcare systems, and which will help to strengthen our universal healthcare coverage model, which has been recently introduced by the government of Pakistan, and accessibility, affordability, and equity issues will be resolved for the population of Pakistan. Thank you very much, and your questions are welcome.